Welcome to Unveiled Radiance, podcast to help you strip away fear of aging. Hello, I'm Dr. Natalya, licensed naturopathic physician, aesthetic expert injector, and owner of Bloom Skincare. In each episode, we will discuss everything about skincare, strip away confusion about aesthetic medicine, and help you deeply understand what happens in your body as you start aging. We will invite expert opinion and, of course, science-backed information to help you deeply understand you. This podcast is part of an educational platform called Unveiled You, which I designed for women just like you to help you understand everything, not just about your skin, which is your largest body's organ, but everything that's happened to your body from puberty all the way through past menopause, and enjoy and embrace every stage of that beautiful life. Let's get started. I am Natalya Borakowski, and welcome to Unveiled Radiance. I'm here with my dear friend, Jigna Patel, the doctor, all the way from London. And today's episode on Unveiled Radiance, it's all about skincare. And yes, we still talk about aesthetic medicine. The name of this talk is Syringe or Serum or Syringe, it doesn't matter. But essentially, we want to have this controversial conversation with our clients to tell them why skincare is truly important, because so many people choose injectables, let's say a Botox, over even the sunscreen. I do have patients, believe it or not, that inject their forehead like a clock every 3 months, and they look at me like a deer in the headlights when I tell them, oh, what do you use for your skincare? So let's chat about this. But before we get into the whole nitty-gritty of this conversation, I want Dr. Patel to tell us about her, because her journey to aesthetic medicine is quite interesting.
Thank you so much, Natalya. I'm so proud of you for doing this podcast. And I think our conversation was always going to materialize for the world to hear. Natalya and I met actually during the pandemic online as part of a big practitioner network, and then finally met in person in 2023, I believe, when we were in Paris at a major conference. And the rest is history from that point of view. So here we are. So I am a senior primary care physician here in the UK. I've been practicing for a number of years now as part of the core crux to my medical life. But along the way, I found my love for dermatology and skin health. And I say that now in reflection because I don't practice everything in the aesthetic medicine field. And you know that. And I found what I was really passionate about, and I found the way to navigate my journey and patient journeys using strategies that made sense and respected the whole self. Yes, holistic era is here, but I think what I find most fascinating is the approach and the varied approaches to how we all practice. And you and I have this conversation all the time. And there is mixed camps doing different things. So you can't expect patients or the lay public to actually know what's going on because there's so much confusion, right? But I heavily believe in nurturing and caring for the skin barrier. It's an organ at the end of the day. And I think that's one of the main issues here, right? Where people haven't quite grasped that it is a living, functioning part of our body, in fact, the biggest organ that there is. And more recent years, I've found my love for the skin microbiome. And, I'm going to talk about that at some point, but it really has hit home with me, particularly to sit with patients and talk to them about how to give themselves the best chances or prospects for future treatment, should they wish to want them or have them. I think you and I resonate really well with that because you obviously come from a naturopathic background and truly respect metabolic health and doing the best for nurturing yourself. But I don't think we're all on the same page, and we know this, right?
Absolutely.
And it is a very interesting time, a very confusing time right now, And as practitioners, I'm very, very passionate about not doing the right thing, but doing a healthy thing, doing something that has meaning and purpose without destroying or interfering with someone's confidence, self-esteem, or ignoring red flags, which seems to be what happens a lot. Let's be frank.
Absolutely.
And I think it takes a certain degree of confidence, but also knowledge in order to step forward and start talking truths. Because you can have an opinion, but if you have actual scientific truths, that changes the ball game, doesn't it?
It really does. But it's more than just it's not just a confidence, Jigna. What I really truly admire in you, how courageous you are. And if anybody would ever meet you in a person, you are skinny, mini, tiny little thing, but man, you are a firecracker. And you are such a powerful, inspiring woman. You have a lot more courage than I do. I believed in this for years. And I had to always go against the tide of allopathic medicine and explain to my patients why pharmaceuticals are rarely an answer. They are a good answer in the case of emergencies, the true infections, right? So we're not saying that pharmaceuticals don't have place in this world. They save plenty of lives, but in everyday approach, often drugs are not the answer. And yes, the injectable medications, they are still drugs, neurotoxins, drugs. The hyaluronic acid injections, filler, they are drugs, they are liquid implants. The problem with aesthetic medicine, what we see for many, many years, and it's true in UK and it's true in the United States,
Anywhere.
this medicine being sold to our public as a way of life, sort of glamorous, this beautiful photo model kind of way of life. And the truth is,
Yeah.
it's still medicine. And the patients need to understand that the drug is not always an answer. And it's so great to start those conversations to really open up patients' ears and let them pause and think for a moment. Skincare, it's not just an optional, vague approach or vanity in any way. It's
No.
just as normal as brushing your teeth in the morning. Somehow we teach our children since they sprout their first tooth to start brushing their teeth, right? And we forget to tell them that washing the face every day is essential. Dry brushing is necessary for healthy immune function and lymphatic drainage. Simple steps. It doesn't really take a lot of time. And I don't even want to have a conversation about sunscreen. It really blows my mind how patients telling me, well, I'm not really going out in the sun, so I don't have to wear it. Or, oh, it's such a pain in the butt to put sunscreen. I look like a chalk. It's sticky, whatever the, excuse is.
Yeah.
And it's just, again, beyond just skin cancer. It's just overall taking care of your body.
Yeah, exactly. And I think let's just think about that for a second, because you have a daughter, I have a niece, and I was just talking to her today. And I think about her a lot because at the end of the day, I take my life in professionally very seriously. I don't mean that I'm angry all the time or anything like that. I actually, I'm driven by a purpose. I've worked out who I am. And I think about her and I think about the message that I want to leave with her and have her see. Then it kind of inspired me to think about what's going on in the generation above and our peers and what's going on above us. And I just think we have a responsibility as physicians, practitioners, to do responsible things. That's number one. Number two, where is the line between necessary and unnecessary? I will maintain for the rest of my career that your canvas is the platform to everything else. So nurturing it, caring for it, and I will say outside and within is really important. You can sit there and have injectables whenever they're due, or whenever you think you should have because someone says you should. But actually, how impactful is that result when you haven't nurtured your canvas? I will say it is almost as simple as that, but it's not. because we now both know, and we practice this way anyway, where we support our skin from the outside and in.
Yes.
So the conversations that I have are what I believe is truth, which is before you put something into you, think about whether your canvas is at its most resilient or at its optimal, so you get the best results from whatever else you're doing. Now, I 100% agree with you. We're dealing with medications. And you're right. I think the world of pharmaceuticals and aesthetics has been completely blurred. And some reason people still don't really get it that neuromodulators are medications. And it blows my mind as a physician that people still doubt about taking paracetamol for pain. Just example. Yet here, there, and everywhere with other medications. So quick fixes comes into this, doesn't it?
Yes.
I believe that there are some amazing injectors in the world. There are, of course there are. But I don't believe that everybody has the best intentions with using that strategy as priority. I just don't. Because we've gone from a beautiful industry, which is an art. You and I know how hard we have to work to master our crafts. And you are brilliant at your stuff, and I'm brilliant at mine. But it takes work and constant education. And here we are in a world where people are injecting left, right, and center. Unfortunately, I'm in a country where there's no regulation still, which makes it even more embarrassing.
Yes.
And I think because of this laxity in attitude, people, patients, consumers believe that, well, okay, it's like sweets, isn't it? Not really being able to truly appreciate that this is a method and a procedure or set of procedures. They're procedures, aren't they?
Yes.
So I often will stop people before they even start having a conversation. And it was uncomfortable at first. And I thought, no, because if you're going to ask me, and you will resonate with this, when people ask us, and I'm not trying to be egotistical or arrogant here, how we have healthy looking canvases, it's because we understand these principles.
Mm-hmm.
And it
Yes.
is not about trying to create a false narrative. You know my procedure history. I talk about it transparently. I don't do what half of the people think I have had done. And it's because there is this blurred world of have this, have that. That's the best thing. Now this has come along and you must have all of these things and you must have monthly procedures. Says who?
It's a very complicated conversation because ultimately it doesn't matter where you live. It doesn't matter you're man or woman or child. We want a quick fix, right? You look at your, we'll say a flaw, either it's on your skin or body, and you want to fix it yesterday. And that's why the world of like aesthetics or weight loss, it's such a great industry. And yes, it's so full of fake promises because patients are still seeking for that quick fix that they want to do something in 24 hours. And, you and I probably all have those patients that come to you with whatever skin disease or concern they have. And they say, well, I have vacation in 3 days and I want to look great. And
It
then
doesn't work
you're
like
just
that.
staring them like a deer in the headlights and thinking like, well, it's sorry, you've been in this state for how long? And you're a living, breathing biological body. And that's why industries like that exist. And I just want to kind of talk a little bit more about it to let people understand really when they chasing quick fixes, when they chasing cheap fixes, they might be dealing with unqualified professional. And you're right, many of them are very talented. And we do have a similar problems in some states in the United States that unqualified, uneducated, not licensed providers injecting people's faces. And you did briefly said that this is very prevalent in UK. And I'll say personal story. One of my really dear friends just last year traveled to London because she's been following this woman who is very popular. She has like hundreds of thousands of followers on
Oh, so
Instagram.
what?
And she
So
has
what?
this beautiful, exactly, you can buy them, but regardless, she apparently has a strong following. So she has beautiful transformations before and after, which again, we can argue it could be Photoshop. All
Yep.
she does is using toxin and filler, and she sells her courses. So my friend travels all the way from Arizona to London to get trained by her, spends a lot of money on travel and probably dozens of thousands of dollars on it, training itself. And then as they have casual meal together, a husband of a provider briefly mentioned, oh, she's not a nurse, right? And then my friend, who is a registered nurse here, and she's been injecting for years, says, oh, well, what is she? Is she a physician? No, she's not. Well, is she a cosmetologist? Like, she's very confused. She just can't believe that the woman is not licensed. And then, yes, she's talented. It just doesn't seem like she has any medical concerns. So there might be some self-taught practitioners who's actually doing it well. But at the same time, they are more likely to take risky decisions, to be more of an artist, like basically taking a filler like a clay of sculpting a patient's face without thinking the long-term consequences. Could there be maybe autoimmune response to that? Could
Oh
that be
gosh, yeah.
something more than just a vascular occlusion? Maybe there's a vascular compression now because there's just so much pressing in that filler. There's just so much more than just immediate problem that can arise during the injection. And
Yeah.
here we are, physicians that actually have hours and hours of medical training, and we're more conservative, we're more kind, respectful to our body. And often it kind of falls on deaf ears. So I guess my question to you, were you ever tempted to actually start doing injectables and saying, like, listen, at least I'm licensed, I can do so much better than those schmucks do?
Yeah. So I started out in aesthetic medicine in injectables, which is typically how people start out before the skincare sector really started to take off. So that was the natural tendency, but obviously with reputable trainers. So yes, I do some injectables. Is it my favorite thing to do in the world? No. Does it mean that I can't do it? No. It just means my true love is for other things. However, I think over time and experience and learning from others across the globe who see the light in different ways, you start to really appreciate when someone says, I want to give you the best result or the most optimal result. It is not as straightforward as putting something in like that. It is not. And we could talk till we're blue in the face about that. And there are people who will argue the counterpart because obviously skincare or skin health is not the same as how neuromodulators work, as how fillers work. Of course, they work in different ways, but they are not comparable. If you're trying to, in the long run, give your canvas the best chance at getting optimal results, you need to nurture it first. And that arguably, under safe mindsets and premises, should start when we're young. And what I mean by that is, getting an idea for who you are in your teens. It doesn't mean having a 10-step routine. It doesn't mean doing silly things at all. It just to respect yourself and understand what might be you and your journey. And then nurturing as you go, because as you and I both know, we have phases in life and things happen. Life happens and everybody's
Yes.
not the same. So to try and change the narrative, I think if enough of us churn out the same song, I think people then do start to think, you know what, actually, yeah, because I don't want a quick fix. I want if I'm going to have an injectable treatment, and I have had one this year, I've been too busy and doing other things with my life. My canvas feels great. And it looks great. And I know that I want things natural, and you wouldn't even be able to tell, this. But
Yes.
I get so much joy out of radiating health. Does that mean I'm the healthiest person on the planet? No, but my skin barrier is for me. These are the kinds of conversations I have with people, because this isn't to intimidate or scare, it's to inspire. And you do
Mm-hmm.
the same, I believe. And it is also to teach people how to be savvy, how to
Mm-hmm.
get the most out of their budgets, and how to plan,
Absolutely.
right?
Mm-hmm. Yes,
And
yes.
going one step further, how certain procedures, like let's talk about plastic surgery, facelifts. How can you, as an individual, do the best you can for yourself and your skin health to
Mm-hmm.
get a great result later in life? And that is part of the problem here, because there is a mishap there, isn't there? There's a massive problem. Even with skin rejuvenation treatments, you and I also both know that if your canvas is healthy and resilient, you will get great results from those things, which are not so invasive, you know?
Mm-hmm. Mm-hmm.
So that's the kind of approach I have, and I'm not diverting from it. And if it doesn't resonate with people, that's fine. But ultimately, you can tell what happens in the long run. And you can tell people who have thought about this sensibly. And I don't discourage and say, don't go to this person and that person. I just make people aware that, have you thought about how you're going to get the best out of that option? How about taking care of you and your skin canvas first, and set yourself up for an optimal result? I think I can't get any more clear than that.
Yes, you're absolutely right. I think it's very important to tell our listeners we're not here to shame anybody for doing injections. And for goodness sake,
No,
I inject Botox, filler, and threads for a living. So I'm not saying those procedures are bad, but exactly as you said, if you do not take care of your canvas, aka your skin barrier specifically, none of those treatments will give you a desirable effect. Because ultimately, what ages us, it's skin atrophy. If we don't support the barrier, the atrophy occurs so much faster. You're absolutely right. If the patient decides to do surgical interventions, they go for facelift, brow lift, doesn't matter what procedure that is. If they have a healthy skin, their results will be a million times better than the
oh,
one
and
who
you
did not take
know,
care of
right?
her skin. Yes.
Exactly. We talk to plastic surgeons who are like, goodness me, this is the best type of situation I want to be in. And actually, funnily enough, Natalya, I came back from an intimate conference in Paris recently, and it was really interesting because it was very different to what I'm used to going to. And it was debates and about real life scenarios and about how to improve for patient care and health. And I was blown away, because I've never been to something that is that real. And they were talking, specifically plastic surgeons, talking about the chaos that they're seeing, and
Mm-hmm.
how, in order for them to do the best at their job, it's getting hard because of all the things that have been going on
Mm-hmm.
to get to that point.
Yes.
So I think if those colleagues out there who are in that situation, more of them came forward, I think this message would resonate more. And it will. I think eventually it will. But I think what is so hard for a patient, I try and sometimes almost detach from our careers, because it's hard to forget that we know these things, right?
Right.
But it's so hard for patients to know how to do and what to do and when to do, because it's just far too much information. And there's also a lot of the wrong generation giving advice about aspects of life which they haven't even been through.
Mm-hmm.
So there is a complete confused mess out there. And some of us, like you and I and others that I know, I'm about to join a wonderful team led by a very interesting plastic surgeon who thinks like me, but in a plastic surgeon's body. So you know that's rare, who gets it, totally gets it. And I think realistically, Natalya, as long as we continue to come across in a confident and healthy, safe way, promoting the right message, eventually people will start thinking, okay, you know what? There's something in this. It's not a bashing of interdisciplinary aspects within our industry. It is a wake up and start appreciating that these are procedures and they have their place. but think about what you can do to optimize to have those procedures.
Yes, absolutely. And one of the things I also say to my aging patients when they're trying to chase every wrinkle, every flaw, every blemish, it's really not the wrinkles that makes face unattractive. It's unhealthy skin that does that.
Yes.
So if the skin is dull, if it has any signs of dermatitis, eczema, or any sort of irritation, that's when the person starts to look unattractive, because subliminally our brain receives the message that this person is not healthy. And we naturally attracted to a healthy, glowing complexion because we naturally think that person is a good person. They take care of themselves. They might be also good enough to take care of everyone around you. It's just kind of like a subliminal messages you process before you even open your mouth or say anything. And that's how you decide, looking at that person, oh, she's a great person. Oh, I want to get to know her, right? So taking care of your skin barrier goes far more deeper than just taking care of every little tiny wrinkle or blemish. Because there's many patients that I know that come to my clinic, they don't have a wrinkle on their face, and yet they look aged. And that's essentially what that is. The skin is unhealthy. Yes.
Right. So let's just hone in on that, because you and I, well, this is what blows my mind, is you and I can move our face. You and I haven't blitzed every single wrinkle that there is, because I'm in my 40s. Yeah, I'm not in my 30s or whatever the supermarket wants to ID check me for.
I'm almost 50, so I mean, hey.
Right, exactly. This is my point. Have we got to this point in our life cycles doing stupid things? No. No. Number two, quite happy to have natural results, which actually means I can preserve aspects of my expression, because that is normal.
Yeah.
Number three, I wouldn't want someone to trust me if I looked body dysmorphic. I just wouldn't. Because I wouldn't put my hands and my face and my body, that's my choice, into someone's hands who couldn't see that they were overfilled, unnecessarily treated, didn't look like themselves, don't even look happy, let's face it. I then think, what do you think about me? What is it you want to do to me? And I've had this happen where, and I don't know about you, but I've had this happen where people are like, I want to correct your facial features. And I'm like, why? I'm really happy with the way I look. Thank you.
You're a stunning woman.
No, but it's not that. It's the injectors. Some of the injectors who, because of their practice and because of them being razor sharp on dealing with anatomy and angles and all of this, that is all they then see in people. I don't think there's anything healthy about that, personally. Because you are deciding.
Really don't like that. Yeah,
no,
we
but
don't want to look
this
like
is the difference.
Copies of each other.
Thank you.
Yes.
Well, I wouldn't want a copy of me because, wow, one of me is enough anyway. But I don't see that with you. You're an injector, predominantly you do threads, and you're brilliant at that. But I don't ever get the vibe from you that you are sitting there analyzing me. And I've been observing for a number of years, Natalya. And I know, but it's so important, because there are people who look and analyze you. And I've had this personal experience. And I'm just thinking, what gives you the right to decide what is perfect for me? Thank you.
Absolutely.
No. But unfortunately, that is the person or type of practitioner that I wouldn't want to go to. So what I try and maybe give off in terms of vibes of, when I'm on social media or when I'm talking to patients or talking to little ones that are important to me, it is about figuring out who you are, what is acceptable to you, what your definition of healthy is, because that's so important.
Absolutely.
And what my role is in saying no, and I'm very good at that.
100%. I mean, you're 100% preaching to the choir. I'm working on creating this course right now, which we are launching September 1st. So the first part of the course, I call it Beyond the Mirror. So it's all talking to another woman to help her have a good relationship with her self-image. And let's face it, we all have the days when you look at your own reflection, you're like, oh my God, I look horrible today. And that's okay. That's human.
Yeah.
But it's also good to kind of reflect, slow down, and think like, okay, I have a puffy eyes. Well, maybe I had too much salt. Maybe today I'm going to do a little detox tea. I'm going to drink extra water. Maybe I just need a few extra hours of sleep. I'm going to respect my body. I'm not necessarily going to run into the injector room, sit in a chair and say, inject something in me. So I call this whole concept emotional aesthetics, to really start from the point, what triggers you to do the treatment in the first place?
Right.
You know, is it coming from fear? Is it coming from societal pressure? Or it's coming from actual truth? Maybe there is indeed, like, think I had recently a patient who had an old scar, and she was getting married, and all she could see is that old scar in her face.
Yeah, I can
And then the
understand
fact
that.
that somebody's calling her a scar face when she was 9 years old. I can barely see the scar, but for her, it's that emotional trauma. So absolutely, aesthetic medicine is brilliant for that. We can erase it. We can do lasers, fillers, whatever we need to remove the trauma. It's different than just trying to fix something that maybe you just didn't have enough sleep that day, and now you see dark circles, you know?
Or do something where it wasn't necessary and you then create a problem, and then you do more to try and correct that. And then you get into this
Absolutely.
vicious cycle with an injector, for
Yes.
instance, or a skin specialist. And where is the stop button? Where is the
Yes.
accountability
Yes.
to go, you know what? I think we need to go back and address your why. But unfortunately, a lot
Yeah.
of people aren't confident enough or refuse to have that approach. Why? Because it means that they might lose business, let's face it, or they may, in fact, not have their patients' best interests at heart because they haven't sat down and actually decided to figure them out. Emotional aesthetics is a slippery slope because with that comes a lot of pressure, I think, to deliver and perform, right? And if there is
Yes.
a miscommunication between patient and practitioner, you're just setting yourself up for a fail and making
Yes.
somebody's
Absolutely.
emotional fragility worse. Because the right thing to do would have been to step back and say, you know what, we got to deal with this trauma and this wired and tiredness and this person who thinks you should have this because that will make you more validated and acceptable. We need to deal with that mindset before we then actually do this. And for some people, it's completely life-changing because they may then realize, actually, I didn't need any of this. I needed this approach instead. But that's our responsibility, Natalya.
100%, 100%. And I think hopefully when we talk to our patients, and I do have those conversations, I tell you daily, when I see a woman in my chair that asks me for a procedure and I just explain to her why she doesn't need it. I give her a mirror and I tell her, please look at your face and see how beautiful you are. And often I just kind of like look at her and I say, do you hear me? Because often she doesn't. Often that trauma or whatever, that disconnect she has from her image is already so deep, I cannot reach it there. And that's the reason what really got me into doing this whole project, because I heard thousands of those stories, Jigna, and it's very heartbreaking. And I know I cannot knock on everyone's door and I cannot reach absolutely every woman, but at least I can try. You know, at least I can make that course available, and the woman who might be slightly curious maybe will go through the steps and do the transition, and hopefully it will wake something in her. Because ultimately, when we're happy with ourselves, your world changes. You just like open up to so many possibilities.
Right. And I think let's just think about that and tie it back to skin as well and deal with your demons and darkness. And I know I've shared my journey with you personally, and you've been there throughout, and I appreciate that. It made me a better physician and practitioner anyway. It then made me think, okay, in order to emit this infectious, positive, healthy energy, I have to really sit comfortably with what I am. Can I and do I want to improve my health? Yeah, of course I do. That's because it's important to me. And for me and for everybody, skin, the way we are as humans, visual appearance for a lot of people, it is a massive deal breaker for some, whether it's career wise, whether it's validation wise, whether it's getting a job or whatever it is. But it can be done in a much healthier way. But for me, I take my daily steps in my skin plan as a ritual. It is a ritual for myself. And I try and nurture patients to think of it that way. It's not a task, it's a part of your living ritual. Because if you're
Absolutely.
there and you just be and you sit for 5 minutes, and because everyone's got a lot of time to complain about not having time, right?
Yes,
It
100%.
is you time. If that
Yes.
time in the bathroom or your own little heaven, whatever it is the 10 minutes in your day to be with yourself and involves a healthy ritual that sets you up for the day or wind down or whatever it is, you're doing yourself a service to your psyche and to your health, as long as you're using stuff that actually makes sense, of course. But it is part of life. We're not living in the mountains where everything is pure this and we're in a lot of us in cities, right? We're in chaotic lives, we're in pollution. So yeah, of course our skin has to adapt to certain things and use certain things to protect us. But I think what I try and it's almost like snapping people out of this whining cycle. It's
Yes.
like if it really means something to you, it is down to you to make that change. I'm here to support it. I'm here to nurture you, but you have to meet me halfway. That's how I practice, Natalya. You know this.
Yes. And I love that. And I think you and I already touch on so many important topics. And I think each and every one of those topics could be a completely separate episode or Instagram live or whatever, because we can dive so much deeper into anything. But kind of bring it all up the full circle. The main question is serum or syringe? And the answer is there's no answer. We don't try to discourage women who choose to inject something in their face not to do it. All we asking is to pause and to really think, do you honor your body for doing so? And if you
Yeah.
are, fantastic. Healthy skincare is actually quite simple. And it is a skincare that honors your skin barrier. It's not about stripping your skin. It's not putting acids on every day. It's not drying it with retinol. It's again supporting that living organ and understanding that your skin changes every single day as you change, as you go through seasons. Either it's the seasons of the year or seasons of your life, going through events such as puberty, pregnancy, menopause. Everything in your skin will change as you go through it, and you should adapt and love and then nurture yourself through every process.
Have evolved so much in the last 2 years and really started to hone in and understand our skin barrier and how it communicates with our systemic health and the role of microbes. And it has blown my mind because it's made me step back and redo my way of practice and realize that certain things can be simple. Certain things have its place. To radiate skin health, we have to support our organ, protect it, nourish it, and adapt, as you said, as we go.
Well, I love it. It's been a great conversation. Thank you so much for joining me, Jigna. This is fantastic. So this is Unveiled Radiance. Follow us. Let's grow this community together. Let's get more women involved and to hear this message. And let's all age gracefully, beautifully, and still stay in ourselves.
Thank you so much, Natalya, for having me. I'll just do a shout out. You can find me on Instagram at Vedaskin Clinic.
You and I are going to do another Instagram live. I swear God, we have to talk about microbiome. Absolutely. We have to have a separate talk about it. And another thing, as we were chatting through it, I had a thought, how about you and I have a conversation about this whole, Dr. Google and ChatGPT epidemic, right?
Oh, yeah, I'd love to.
Right? Following advice of people who have no business of talking about it and trusting them over advice of actual physicians. I think that's going to be a brilliant conversation. So we should blend that.
Yeah, we should.
All right, my love. Thank you so much for joining me.
Thank you for having me.
Thank you for joining me on Unveiled Radiance. If this episode resonates with you, please share with someone you love, with another woman who might need to hear this information. And for full experience, head to unveilyou.life, where we share everything about skin, hormones, and even self-confidence. Until the next time, thank you for joining me, and please take care of yourself from inside and out.